Like, okay, Dr. Melissa, you may start the meeting.
Assalamualaikum warahmatullahi wabarakatuh. Hello and welcome to our 51st APAN dental session entitled How to Produce a Qualified Dentist During COVID-19 Pandemic. Before we begin, I would like to share a few helpful information. Please let me share my screen. Okay. For those who are recently joining us, Asia Pacific Advanced Network, or APAN, is an international independent association coordinating activities related to network technologies, services, and applications among its members and with its peer international organization. So APAN is also a key driver in promoting and facilitating network-enabled research and education activities, and these include research collaborations, knowledge discovery, sharing, telehealth, and natural disaster mitigation. So we regularly have this type of meeting to share different type of topics, so please feel free to join us anytime. And today's speakers, actually, we have 4 speakers, Professor Nakamura, but unfortunately he cannot join us. And then we have Dr. Muhammad Ruslin, the Dean of Faculty of Dentistry, Hasanuddin University. And then we have Dr. Ninu Haryani from Airlangga University and Dr. Lisa Amir from Universitas Indonesia. Some helpful tips during this webinar. First, you are in a large group Zoom meeting platform. The chat feature will be used to ask questions to the speaker throughout the session. So feel free, if you have questions during the session, please type in your question. We encourage you to ask questions and comments using the chat feature to our guest speakers. And please state to which speaker you are addressing the questions when you write them, so we know who to ask during the question and answer session. And your question will be answered at the end of the session after all presenters finish their presentations. And today's session are being recorded, so you can view the event again at this YouTube link later on. And the recording should be posted within about 24 hours after this conference. And if your connection is interrupted and you need to leave the event and wish to return, just click on the same link we have given you when you register. We're so happy that you are participating in this event, and please have a lot of questions so we can have a very fruitful discussion. So our first speaker will be Dr. Muhammad Ruslin, the Dean of Faculty of Dentistry, Hasanuddin University. All 3 speakers will share their experiences during this COVID-19 pandemic, how each faculty adapt and use a lot of innovations in dental education during this COVID-19 pandemic. So please, Dr. Muhammad Ruslin, you have about 20 minutes.
Thank you very much, the moderator, Dr. Melissa Idiatman. Good morning, everybody. And first, on behalf of Faculty of Dentistry, I would like to say thank you very much for the organization committee to give us, Faculty of Dentistry, chance to join with this event. I think this event very wonderful, and I think this is very make a big value for the future to join for 51st Asia Pacific Advanced Network. And in this time, I would like to present our experience how to survive our education in this pandemic situation. Let me share my PowerPoint, and I think wait a moment. Sorry, a little bit need more time. Okay. Ini ya. Wait. Yeah, please share the screen. So when the pandemic, especially in Makassar, started on March, and that time I think we are very difficult to arrange for the education activity, because before we know, we start with offline method, and suddenly we must to change. Next. Yeah, this is dentist education through pandemic era in our experience in Faculty of Dentistry, Hasanuddin University. Next. So Faculty of Dentistry, next. Was first established based on Hasanuddin University counselors, and currently Faculty of Dentistry managed with study program, Doctor of Dental Medicine study program, and also we manage a special dentistry education program, and the last is postgraduate program. And this is our team. We have still nomenclature. All we say in Makassar, this is all nomenclature, because I know in like University of Indonesia and also in University of Pajajaran Bandung, they have a little bit different platform for in the management. Faculty of Dentistry, Hasanuddin University, for the Doctor of Dental Medicine, recognized as a grade A based on Indonesian Accreditation Agency for Higher Education in Health. And also, we already recognized by Asian University Network Quality Assurance since 2019. This is situation when before pandemic, we know 100% learning process we do offline, face-to-face. Now, during COVID-19 pandemic area, we do transformation of students and also lecturer adaptation, and the learning process at the preclinical program, clinical program, and resident program with an online system. Learning online system start from March 28, 2020, and we do like to do like respond and adaptive according to the application method during pandemic. We do with setting strategies in teaching and learning method. The distant learning process for lecturers and students requires adaptation of the communication style that we know as online communication. Some of application method during pandemic, like online learning, so we do like student learning method from their respective homes. So we always say work from home, and then the education manager or dental education unit, they still monitor the learning process online from home also. The learning process continues according to the predetermined schedule, and we create like virtual and digital based on webinars. Also, during in this pandemic, pursue us to do some like innovation. Also, we product one instrument, we say a magic extraoral manage to reduce the aerosol for the manufacture of health product. This is already set up, and we use in our use in dental hospital. to give services for the enduring pandemic area. So increase the number of publication also in intellectual writing on campus, maybe because our lecturers, they do work from home and there is no practicing, they're not going to practice, and so they have a lot of time to do some like publication and writing. So our published in 2020 more than 151 on Scopus. So in a new normal, according to the policy in Indonesia, for the first phase is industrial and business services, social distance and health requirement, also health sector fully operation like health system capacity requirement. And phase 2 on June 2020, 2020, stores, market, and shopping centers opening, strict health and protocols. So in that time, we do like some activity, joint research with Faculty of Dentistry with Faculty of Engineering. So we do meeting to prepare instrument to catch the aerosol from the extraoral. Also, we do like some classes on online class. And then for the graduation ceremony, we do with first we do on June August we do with online fully online graduation, but in the last of November we do like hybrid. Some of our college they do in faculty, and the all of the students they do in work from online system. So we do also international symposium series. Till now, we already set up till six activity for the international symposium series. So in the new normal policy in Indonesia for the phase 3 on June 15, 2020. So we evaluation of the like salon, spa, and others opening strict health protocols. So culture activity like still they do with social distancing, and learning activity, SIP system. So in phase 2 in June 2020, they do like outdoor sport law, and so evaluation of wedding venue opening, social activity, and others. So maximum person 10 persons. Till phase 4, July 6 July 2020, evaluation of economic activity opening of restaurant, cafe, bar, gym, and others. So during this time, our activity also for the staff members, we do like shift system. Some of our staff come only health, and then we do some every week. Always we change the strategy according to the pandemic situation in the new normal policy in Indonesia. Till phase 4 and 6 July 2020, out of town trips, limited number of flights, religious activity with a limited number of participants. On phase 5, 20 July 2020, opening of economic premises on the large scale. All of economic activities has reopening, like hygiene protocols and standards. So in the activity in our campus, like how to get the psychomotoric requirement substitution in pandemic area, we do activity. The students, they go into the laboratorium in Pantom, they do substitution. So they're not doing in people anymore. And then this situation, we make like a high regulation for the protocol kesehatan. So they do use mask, face shield and before, and we do a screening for the, if possibility they get COVID-19. Also in clinical phantom in dental hospital, Hasanuddin University, we provide as patient simulator. So we do activity, use torso for the substitution of the clinical activity. Based on government regulation about new normal policies, Faculty of Dentistry Hasanuddin University is preparing also policies like pre-clinic activity. So the activity lecture activity with a SIP system according to the number of places with a strict health protocol. And clinical activity, reactivation of the co-assistant and residents activity with strict health protocol. But in this clinical activity, till now, we just start for the residents. So for the co-assistant, still they do with online system, and they go into the laboratorium and to do activity with substitution in phantom. For the administration, they do with activation and administration activity with a SIP system according to the number of places with a strict health protocol. This is the concept of the new normal based on the Ministry of Health decree numbers about guideline for the COVID-19 prevention and control in office and industrial workplace in supporting business continuity in pandemic situation. So we do wearing a mask is mandatory, application of community members through clean and healthy living behavior, body temperature screening, physical distancing, enforcement, and also prohibiting of the entry for workers with indicated symptoms. So in the last, we do coordination with our government in South Sulawesi and also with the Dinas Kesehatan Kota Makassar. We do vaccine. So in this time, today is the second days for the vaccine massal. So we already registered all of our staff members. Start from the doctor and also resident, co-assistant, and also the staff members to give vaccine. So in this, we collaborate with some all of our workers, healthcare facility, public health services, employment services, and also office and industrial workplace to do give them a vaccine. This is on the Monday situation, the COVID-19 vaccination in our university. And I think that's all our experience in the Faculty of Dentistry during this pandemic. So almost 1 year. I hope all we us can survive in this situation. And again, thank you very much to joining us in this event. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Dr. Ruslin, for your presentation. Because Dr. Ruslin will have another event around 10 a.m. So if you want to ask questions now to Dr. Ruslin, please feel free to write it on the chat room. So maybe first question is from me, Dr. Ruslin. For the professional level, the undergraduate professional level, they do their requirement using the Phantom. Is it correct? So do you have any planning when you will start for them to do patients again, or? Yes.
Actually, because in Makassar, the situation of pandemic is more on last November is already decreased, but so we already planning to do like for the co-assistant going to the dental hospital, because for the residents we already start. So resident now we already start. They do some activity services in the dental hospital, also in the Hasanuddin University Hospital. But for the co-assistant, we have planning on December, but the situation suddenly changed. So the pandemic incidence numbers is very higher. Now every day almost 500 till 550 the incidence of the COVID. So we cancel. So we're waiting for the activity. Maybe we start on the February or March. So now we pursue our all students, staff members going to get vaccines. So maybe they can have a little bit of protection, and then we can do again activity in the clinic if the government give a license to do that. Yeah.
Okay. Thank you, Dr. Ruslan. Is there any questions from the other speakers, maybe?
Me, maybe,
Okay.
Dr. Melissa.
I saw Dr. Lisa.
So
Maybe
Dr.
Dr.
Lisa
Aksa,
first.
no, Dr.
Dr.
Aksa,
Lisa.
plus, Dr. Aksa first, please, Doc, go ahead.
Okay, thank you, Dr. Lisa. How about your research laboratory, Dr. Ruslan?
Yeah. Yeah.
You know, almost every laboratory are suspended right now.
Yeah.
How about in your institution? Can
Yeah.
students and staffs do the research in the situation?
Yeah.
Thank you.
Yeah, thank you very much, Dr. Aksa. For the research laboratory, 1 week ago, I have been going to the laboratory, Pfizer laboratory, fishery laboratory, to do some like research. Our regulation in our university, the laboratory for research is still open, but I have more limitation numbers. So very, very limit numbers, the activity in the laboratory. Only special case like the for the students, when they are in the last program in this year's sample in this year's, they are last program for the thesis or scriptsy, they must go into the research. So they do with going to laboratory, and but limited numbers, person, and also activity. So very, very strict regulation.
Thank you.
So still open, yeah.
You can see that the research publication has increased to 151 on Scopus.
But I know in University of Indonesia it's 200.
Dr. Lisa will. Yes, okay. So please, Dr. Lisa, your question.
Thank you, Dr. Melissa. I think my question is really related to Dr. Aksa question that just been posed recently. So I congratulate Dr. Ruslan for their achievement in the increase in publication in Scopus. I think it's a hard work to get it in that position. And my question is related to research for students for scriptsy or for thesis. Do you have any modification on the regulation? You mentioned that the activities in laboratory are still open but very limited. And can you elaborate more if students have the sample collections from the patients? Are there any regulations that applied?
Yeah. Thank you very much, Dr. Lisa. For the students, research students, we really changed everything. So first, the regulation for the scriptsy, they must do it like descriptive analysis or like minor research they do in laboratorium, and they go into the rural area to get some samples or to do research. But now, all of scriptsy, we change to do like literature review.
Okay.
So we do like rapat senat, yeah, in our faculty, and we make decision. All of scriptsy, the methodology only use literature review. But if you have like descriptive analysis, and you can take like samples or data just for the descriptive in the hospital, they can do. So only no activity can do with touch for the more people, or they go into in the rural area to get samples or data, it's forbidden. So they do only literature review. Yeah.
Literature review or using the secondary data.
Yeah, it's correct. Yeah, it's correct. Yeah,
Okay.
secondary data.
Okay.
Yeah.
Thank you, Dr. Roslyn.
Yeah.
Okay, thank you. Is there any more questions from other speakers? Okay, we haven't got any questions.
I will have to say, I forget it. For the publication, we do because Alicia always come to Makassar to give supervising to my staff. Lisa already 2 times come to Makassar.
Really?
Yes.
Yeah.
For journal reviews and publications collaborations.
Yeah.
Yes. Okay, so thank you, Dr. Roslyn. We will move on to our second speaker. If the other participant would like to ask more questions, please post it first on the chat feature, and then we will discuss it after all speakers have presented. So our second speaker is Dr. Nino Haryani from the Department of Dental Public Health and Preventive Dentistry at Erlangga University. She got her PhD from the Population Oral Health Adelaide University. So Dr. Nino, if you're ready, please start your presentation, about 20 minutes.
Okay, thank you. I will share.
Dr. Nino, can you unmute your microphone?
Yep, sorry.
Okay.
Okay, let me share the presentation. So everyone can see this PowerPoint?
Yes.
Okay. Okay, thank you so much, Dr. Melissa, for the introduction and give me time to share these topics. Good morning, everyone. Today I will present the topic about how to produce qualified dentists in the pandemic situation that we face right now. And it's merely sharing experiences from Erlangga University. I will divide my presentation into 4 agenda. At the beginning, I will talk about give brief overview about the pandemic situation and the need for us to change our method in education system. And after that, I will come to the concept and strategy that was adopted by Faculty of Dental Medicine, Erlangga University to face this situation. And then we will talk about the concept and strategic in learning, research, and community services that we already adopted. And finally, we will share some experiences from the education learning that we already conducted in the last year during the pandemic situation. This shows the blueprint of Faculty of Dental Medicine Erlangga University in the new normal era. As we already know, the world right now has faced the same problem that we faced the COVID-19 pandemic era. Even though right now we already moved to the new normal era, it means that the transition of COVID-19 is still high, but we already knew that the life must go on. So we should have many solutions to provide the education system. For Erlangga University, we have a priority solution in the new normal era, in which the policy should focus on the health of our lecturer, dental student, administrative person, dentist, clinical instructor, and the patient. By adopting these aims, we put our strategy into healthy behavior, keep physical distancing, and provide healthy dental hospital. We offered a solution through SEE education, with an appreciation of safe, effective, and efficient education. To adopt this aim, we produce two policy. The first one, we reduce the department-based face-to-face learning and increase the online integrated blended learning. The second policy, we reduce the learning process with real patient and move it to learning using many teaching aids, combining online blended learning and using case-based learning. This was a basic concept of strategy development adopted by Faculty of Dental Medicine, Airlangga University. At the first one, we aims to improve the quality of education, which is to produce adaptive and resilient dentists in a disruptive COVID-19 pandemic era. Here, we also involve all stakeholders. What we mean here is the academic peer list and all of our employer reputation peer list through integrated IT-based learning, research development, and also community service. To produce this aim, we supported by smart infrastructure, smart academic, smart human capital, smart financial, smart student, smart research, and smart community service. It's come to our aim to become a smart campus. We hope that by adopting this strategy development, we could contribute in the achievement of Airlangga University rank by being one of the leading dental medicine facility in Indonesia. Thus, all learning activities in Airlangga University were directed to ensure that we provide quality education. We could reduce the inequalities among our students while still maintaining good health and well-being. And all of this aim we want to achieve by putting new learning strategy. This was blueprint for undergraduate study in the Faculty of Dental Medicine, Airlangga University. As we can see here, this shows the changes for the blueprint of the study in Airlangga University since before the COVID-19 pandemic, during the COVID-19 pandemic, up to now when we come to the new normal era. Previously, the lecturing activities, or we also call department-based face-to-face lecturing in Airlangga University was conducted up to 65%, in which among them only 25% was conducted using online. However, we move right now during the last year when the pandemic hit us in 2020. Even though our lecturing activities still 65%, we already increased the online activities up to 50%. And next time during the new normal era, we aim to reduce this one only to 10%, but using online blended learning for up to 95% among them. For the practical last session, which previously before the COVID-19 pandemic era is about 10%, during the new normal era, it will reduce to 5%, and 95% of them will be conducted using online blended learning. Before the COVID-19 pandemic, usually we already use practical activities using mannequin as well, which is contain 50% of all our activities. But in the new normal era, we want to increase the use of mannequin until 35%. And among them, online blended learning will face 95% among them. And the integrated problem-based learning, this method already conducted as well since before the COVID-19 pandemics, but only for 10% among all other activities. We're planning to increase this integrated problem-based learning up to 50% during the new normal era. So basically, during the new normal era, we will reduce the face-to-face lecturing, reduce the face-to-face practical activities, increasing the practical activities using mannequins, and increase problem-based learning. Sorry, it's a bit hang, I think. Okay, let me start. Oops. I have a problem with my presentation. Let me see.
Probably you can close the PowerPoint first and then try to open again.
Okay. Okay, this is the learning concept that we applied during the COVID-19 era. So we move the learning in the COVID-19 era with adopting the new concept. So we moving from the department based into the integrative phase. Here we adjust the proportion of the face-to-face and online lecture by using the integrated blended learning. We also adjust patient practice in the dental hospital by limit the human patient and use dental simulator Nisin Magnikin Pantum Head. With all of this, we try to moving from a requirement based into a competency based education. This one shows the concept of research and community development in the COVID-19 era adopted by Faculty of Dental Medicine, Universitas Airlangga. We also adopting the new concept here. So we optimize the research and community service results while also increasing our research collaboration. We use our research collaboration and our community service also to support the learning process. Here we optimize some our previous programs such as a young professor, a visiting professor, staff and student outbound and inbound using a new concept based on information technology. We also create a product based on our research so it makes it useful for the community. The aim is to increase the affordability and accessibility of the research product created by Universitas Airlangga researcher. And it's also enrich research-based learning materials for our students. Basically, the concept of research and community development, we want to increase students' learning experience as well. So here are some lecturing activities that was conducted in Universitas Airlangga. We conducted online blended learning, which is a combination of online and offline activities. We were supported fully by Universitas Airlangga. Airlangga University has developed some learning platform such as learning management system, Airlangga e-learning in mobile application, massive open online courses, etc. Here, if you use the learning management system and Airlangga e-learning in mobile application, it's a platform that was made by Universitas Airlangga in which all of the lecturer can meet with the students in an online learning. We can provide our materials there. We can create a lecture and we can also make an assessment and discussion through this platform. However, we also use this platform in a combination with other media such as Zoom, Google Meet, WhatsApp, etc. And basically, it's depend on each lecture which more comfortable for them. Universitas Airlangga also provide supported assistance. For example, the library of Universitas Airlangga has provide remote access for students who were living in remote area, so they will be able to access our resources even from their home. Universitas Airlangga also has subscribed to many dental databases, so it provides access to many journals or books, and by giving the remote access for our student, the student could access it easily from their home. So the online learning in Universitas Airlangga can be implemented bisynchronous and asynchronous. What I mean in synchronous, we provide a meeting from the lecturer and dental student in one time, so we can provide feedback directly. Usually, lecturer choose using a platform like Zoom or Google Meet to conduct this synchronous activity. However, some other lecturer think that they will more comfortable with the asynchronous method, which is delayed response. Asynchronous means the lecturer could provide the materials through our platform, such as learning management system, and we provide create discussion through the systems. If we have time later on, we can have a tour like to see many of our platform that was provided by Universitas Airlangga. Further, online learning includes content delivery, interaction, and assessment so that the quality assurance can still be verified during the process. So, at the same time, we also conducted some of our activities using offline. While offline activities was needed, it should follow very strict health procedure and protocols. During the pandemic situation, we also create a program. This is what we said, that we make a collaboration. We strengthen our collaboration with our peer academic peer list. So we conducted StopIt online series. Here we have 4 activities. We have StopIt seminar online series, StopIt hand-on series, StopIt summer course, and StopIt community empowerment development. Here we collaborate with our academic peer list to provide online seminars or online hands-on. And if some of you are interested to collaborate with us, we can talk later about this. We already have many lists of this online series during 2021. For the practical session, we divided our course according to the stage. So some practical activities that previously was conducted in the university through skill labs, we aim to give the opportunity for students to mastering these skills at home. So for the practical activities that was conducted at home, the theory and discussion has been delivered previously through many platforms and usually provided in type of video conferencing or video tutorial. Then materials for practical session were sent to each student's house. It includes module and dental models needed. The monitoring and discussion about the practical session were conducted through many platforms. The supervisor can choose whether use Zoom, WhatsApp, or our Aula, the learning management system that I said earlier, and could be done synchronous or asynchronous as well. If the practicum is done independently, then the process is documented and the result of the practical session in the form of photo or videos were then sent online according to the direction of each supervisor. Portfolio of the student education process was documented and created and saved by the supervisor. At the next step, the practical activities was conducted using dental simulator Nisin mannequin phantom head, and it was conducted in laboratory in the faculty. The number of students was very limited, and we still keep the distance and using all the health protocols, a very strict health protocol. And we already planning to do the practical activities with real patient. However, depending on the case, and as we know, the number of COVID-19 cases are rising right now, so we still postpone these activities for further discussion, seeing the condition in Indonesia. I think that is what we can share from Airlangga University. Do I still have some more time, Dr. Melisha?
Yes, Dr. Reno. Do you have some video you want to share?
Okay, let me see. So this is some platform that, oops, could I show? How to make it shorter? Okay, this one. So this is the library resources that was provided by UNER. So UNER have access to all of these resources, and we also make our student to have remote access. So with this remote access, the student will not have any particular difficulties to access all the resources that we provided here. This is the e-learning system that was made by Universitas Airlangga. So here we can provide and manage our learning session during the semesters. So each of the PJMK, or what do you call it, the course coordinator, they can manage every activities here. We can also make a quiz or make a discussion online with our students. And for some of the lecturer that want to prefer the video, we also provide help for them to create the video by the MOOCs that was supported by Universitas Airlangga. I think that's all that we can share for right now. Thank you.
Thank you, Dr. Nino. Shall we have the question and answer now? Or maybe I think because a lot of points that we can discuss together. So perhaps we continue with Dr. Lisa's presentation first, and then we will have more discussion afterwards. Thank you, Dr. Nino, for your very interesting presentations. So our last speaker during this session is Dr. Lisa Amir from Faculty of Dentistry, Universitas Indonesia, Department of Oral Biology. And she is now our coordinator for the undergraduate education. So Dr. Lisa, could you start your presentation for about 20 minutes?
Yes, thank you, Dr. Melissa. Is my voice can be heard clearly?
Yes.
Okay, I will share screen. Okay, good morning, dear professors and doctors. I hope all of you are in the safe and in healthy condition. Dean of Faculty of Dentistry Universitas Indonesia, Prof. Lindawati Kusdani. Unfortunately, she was not able to attend this important meeting today. She sent the highest regard to all of you, and I will be presenting the recent study that was performed in our faculty on her behalf. As we all experiencing the changes in the learning strategies during this COVID-19 pandemic time, our faculty recently conducted an evaluation on the implementation of distance learning during COVID-19 pandemic in the undergraduate dentistry study program. So the World Health Organization has declared the pandemic of the novel SARS-CoV-2 infection early last year, and it has now become a major public health challenge worldwide. The infection control and the physical distancing measures are crucial to prevent the virus from further spreading. And the a compulsory physical distancing policy has been implemented in many countries, including in Indonesia, and resulting in the nationwide school and university closure. And in accordance with this policy, that the dental academic institutions are compelled to make appropriate and timely modification so as to continue the to deliver the education and for the student academic progress. So the learning and the teaching activities were immediately shifted to full e-learning. Before the COVID-19 pandemic, our learning strategies was the student-centered active learning, and all the learning activities, the discussion session, the clarification session, as well as the practical session were all conducted in classroom with the online support. And here are some documentations of our PBL session before the pandemic, and as well as the skills lab session. And during the COVID-19 pandemic, all of the learning activities were delivered through distance learning, utilizing a variety of the online platforms, such as the Microsoft Teams, Google Meet, Zoom, or Universitas Indonesia Learning Management System, or UMAS. And these new learning strategies has never been implemented previously in our faculty, so we learn as we're doing it. So from February to mid-March 2020, all the learning activities were conducted in classroom with the online support, while the full distance learning was initially implemented in our dental schools on March 17, 2020. And here are some documentation of our online PBL discussion, as well as the skills lab session. Despite the previous reports on the comparison of the distance learning and the classroom learning, very few studies have reported the student-centered active learning delivered in full distance learning. So in this particular study, we aim to analyze the student perspective of student-centered active learning delivered in full distance learning compared to the classroom learning. And we hypothesized that the student positive outcomes on the acceptance of distance learning as a new learning strategy in our dental school. So the study was conducted between May to June 2020. The first, second, and the third year undergraduate dental students were participated in the study. The online questionnaire was given at the end of the semester. They were strongly encouraged to fill out the questionnaire. However, their participation remained voluntary. Before the pandemic, our learning strategies was used the classroom learning with the online support. So the Universitas Indonesia Learning Management System, or UMAS, was used to support various learning activities. So students could access the syllabus, the learning objective of the learned subject, and the scenario, as well as the list of subtopics, of list of questions, or list of reference provided in the course. And for the collaborative learning and question-based learning was mainly used for courses in the earlier semester, while the problem-based learning, or PBL, were mainly used for the courses in the later semester for the second and the third year students. For PBL discussion, each group has approximately 10 to 13 students and was facilitated with one facilitator in each group. And during this COVID-19 pandemic, all of the learning activities were immediately shifted to full distance learning. And in order to make the online discussion stay similar than it has been before the pandemic, it has been conducted before the pandemic, then courses are delivered synchronously with the attendance of facilitator and or tutor. And for the skills lab or practicum classes, which the expected learning outcomes involve a variety of the psychomotoric skills, were either substituted with the video simulation or presented the stages of work online, or postponed until the university is ready to be open or to resume its activities in campus. The questionnaire was created to assess the student perception of distance learning, and the response options resemble the Ford Likert scale. In altogether, there were 22 statements that comprises of the general information of the student gender, student year of study, as well as the student GPA. And we also assess the preferences, effectiveness, and learning satisfaction domain. And logistic regression analysis was performed to identify factors that associated with the student preference toward distance learning. So there were 301 students participated in this study. The response rate was 84.3%. And we found that there were a higher preference toward distance learning in the first year students compared to the senior year students. And one of the plausible explanation of this finding might be related to the curriculum implemented at the time of study. So first year student, basically they studied more basic dental science or basic medical science, which comprises of conceptual theories, while the senior year students, they studied more clinical dental science courses, which comprises both the conceptual theories as well as the procedural skills and knowledge. And essentially, such courses require the laboratory skill session to enhance their understanding of the learned subject. And as the execution of the dental laboratory works was either postponed or modified, and this resulted in the less motoric skill experiences, and also less direct consultation with the instructors, and less practical assignment that were normally used as the reinforcement of the theory class. So we found that perhaps this might have influenced the student preference toward distance learning. And from this study, we also found there were no correlation between student preference of distance learning with the gender nor with the GPA, student GPA. In the effectiveness domain, it was demonstrated that the student agreed upon the distance learning are a more efficient learning methods, and more than 2/3 of the study participants agreed that distance learning provided more time to study and more time to review the study materials. 1 second. Okay, this is a little bit close. Okay. So in the learning satisfaction domain, the student disagreed that distance learning gave a similar learning satisfaction as in the classroom learning. And only 44.2% of students prefer distance learning over the classroom learning. So the data from the logistic regression analysis confirm that these variables as the significant factors contributed to the student preference toward distance learning. And we found a strong correlation between the sufficient time to prepare the study material and sufficient time to review the study material, and also strong correlation between efficiency and motivation. And we found the efficiency has the highest odds ratio for the student preference toward distance learning. From the open-ended question, it was revealed that the challenges that were encountered during distance learning can be categorized into external factors such as unstable internet connection and financial burden for internet quota, as well as the internal factors such as student readiness for the new learning methods, the time management, and the difficulty to focus while working in front of, studying in front of the computers for longer period of time. And some of these challenges has been tackled by the government policy to subsidize the internet quota for the students as well as for the lecturer. And also, since the implementations of this distance learning continue this semester and also next semester, many students and lecturer, they are more prepared with and more familiar, I would say, with the distance learning methods compared to the first semester when we first hit by the pandemic, because everything was a new learning method, and we still learn, both the students and the lecturers still find the adjustment of the new learning methods. The present study showed the lower preference toward distance learning compared to the other similar studies related to the student perspective of distance learning, which showed that the student attitude and acceptance proved to be shown to be more positive and favorable. However, the previous study mainly reported the distance learning as a complementary methods for the traditional classroom learning, while in the study, the courses are delivered in full distance learning. And full distance learning might offer a sense of unreality, and it largely depends on the student commitments to courses. So these differences, and also the differences in the curriculum given at the time of study, might be contributed to the lower preference of distance learning observed in the study. But I would like to take note that this study was conducted in May and June 2020, when students and lecturers are experienced the first time of distance learning. So it might have a differences now. And from this study, it's also revealed that students recognize more time to study and more time to review the study material. And these advantages suit the learning process of both medical and dental students in the recent decade, since they have to digest a lot of information and keep updated topics. And also, the special attention to communicate with students is essential, since lack of personal contact may affect the development of trust. So where are we now? Unfortunately, due to the unresolved pandemic situation, the distance learning method still implemented this semester and also next semester, starting the 22nd of February. And face-to-face learning will be implemented in a very limited selected skills lab works with a strict COVID-19 protocol policy. So all of the students as well as the instructors need to take the COVID-19 tests prior to the face-to-face session. And also students coming out of the town needs to be isolated for 14 days before the face-to-face session. And as well as the 30%, only 30% of the lab room capacity can be used in order to maintain the safe distance between students and also between the lecturers. And there will be a sterilization procedure for the room in between sessions and many others. And also, despite of this pandemic and difficult times, approximately 97% of third-year dental students could successfully completed the academic program and obtain Bachelor of Dental Science degree. In conclusion of the study, despite some challenges that the dental student face, dental students could adapt to the new learning method of distance learning and agreed on the better efficiency experience during distance learning. And the sudden closure of university globally due to the pandemic, COVID-19 pandemic, although undesirable, present an enormous opportunity for the transformation in the education system, as more tech-savvy generation enroll in the higher education. We as the dental educators need to incorporate the blended learning in our dental education system to design the best feature of classroom and distance learning to improve the overall learning environment. And the study that has been presented just recently published in the BMC Medical Education, if anyone interested to learn more. Okay, that would be the end of my presentation. Thank you very much for your time.
Thank you very much, Dr. Lisa. And now we will have question and answer session. Dr. Yosi Yuanita will help me to gather the questions from both YouTube and Zoom channel. Dr. Yosi, could you please start?
Okay, thank you very much, Dr. Melissa. I was actually speaking before, but I forgot that I haven't unmute my microphone. So I have actually checked to the live chat from our YouTube channel. I haven't found any questions, but I actually have a question from... Okay, there's a question from our chat feature in Zoom. This is from Dr. Aksa. The questions to Dr. Lisa Amir from Indonesian University. How to guarantee the integrity of students during exams in online tests? Please share your experience to minimize cheating.
Yes, thank you, Dr. Aksa, for the questions. I think this is the concern of many of us as the lecturer for the integrity of the results. And there are several strategies that we take for this during the examination for the summative test in this pandemic time. The first one is not only for the students of the Faculty of Dentistry, but to students, all students in Universitas Indonesia, they need to sign the integrity pact. That one of them is to ensure that they will do the test in the all honesty possible manners. And then we also, although not all the tests apply this, but some of the courses also apply during the test using the two gadgets. So one laptop was used to do all the tests, and the other gadget was used as a camera in Zoom to monitor the students' activities. So to ensure that all the students do all the tests honestly, because there's no any other gadget in the desk, and also looking at the monitors of each students. And also regarding the type of questions, we try to also limit the time for the exam, the limit time to exam, to avoid the students from looking or googling around. And also the questions was arranged sequentially, meaning that they need to answer the questions first before proceed to the next. So one page for one questions before they move on to the next, so they cannot go back to the previous slides. This is one of the things that we try to minimize students from screenshot the questions and then asking questions, asking the answer with the other students. So limited the time,
Yeah.
and also make this question sequential, make the question sequentials. And I know it's also a burden with the server, but we usually do the one page for each question, so they need to click next for the next. But it makes the server also running heavier. But we need to tackle this problem. Especially in the cases where the two gadget was not possible, because some of our students are located in the area with a poor internet connection. So it's difficult to have the test done, let alone to have two gadgets together. So we try to understand the situation of all students and to make sure that there's no students left behind. So it's a juggling between trying to believe that they will do the test honestly, in an honest manner, but also we need to strategize to ensure that the cheating will be minimized. Mungkin itu dari saya, Dr. Aksa.
We do hope the best for the student actually. So we also hope the best that they will do the test in an honest way, isn't it, Dr. Lisa?
Yes.
Is there any specific platform that you use in a Indonesian university about, for the tests for the students?
We use the learning management system, Universitas Learning Management System. It's called AMAS. It's a Moodle-based learning management system. I think it's the Moodle-based learning management system was used by many universities, and it proves to be a reliable system for the education tool, web education tools. So, all the exam was done through the AMAS system.
So every lecturer have to use the same platform?
Yes, because then all the scores will be gathered, and there's also analysis of the test. For instance, perhaps one questions were cannot be answered by majority of the students. Then we need to review the questions.
That's a very good.
Yes, and this learning management system make us possible to review the questions. If there are more students, it's called facility index. There are more students who cannot answer the questions, then we need to review the questions, whether we exclude the questions or we still include the questions in the test.
Thank you very much, Dr. Lisa. Moving up to our next question. To Dr. Nino, this is from Dr. Melissa. How do you evaluate the student portfolio, especially in the clinical skill labs that students already documented in your learning management system? How your systems of monitoring and evaluations of the student tasks, I think. Please, Dr. Nino.
Okay. Thank you for the question. Yeah. Thank you for the question, Dr. Melissa. Actually, because we also provide some platform for the learning methods. If the task was conducted using our e-learning platform, usually the same like what has been presented by Dr. Lisa Amir, we can directly manage from that one. So we can collect the system, and then we could also do the evaluation from that one. However, if we do the skill labs for the clinical training, we have the
I'm sorry, Dr. Nino. I think we have a little
Connection.
problem.
Connection.
Yes, in the connection.
Okay, we just wait. Okay, Dr. Nino, just come back.
Welcome back, Dr. Nino. I think this is actually one of our most problem in every center of education, the network problem that sometimes come from ourselves or maybe from other students or other participants of the distance learning, the internet connection. Not every, I mean, sometimes in most, please,
Okay,
Dr. Nino, please continue, I'm sorry.
Do you get the answer or not? Not yet?
We cannot hear you.
I don't know whether.
Sometimes it's like a robot.
Yeah. Okay. So there are two types like evaluation. if the task we conducted using the e-learning platform, we use that one. We can gather the mark directly from the e-learning platform. It's quite similar, I think, with the e-learning platform that the University of Indonesia has. So we can get the mark of our student from that one. We can do the evaluation about the tasks from that one. However, for the clinical study that was conducted, for example, at home by the student, we have a checklist. Through the checklist, the instructor could give the mark according to what they saw, the skill that has been shown by the student through the video or some other platform. So just follow the checklist for that one.
Oh, thank you, so, Dr. Nino. So it's like there's a guidance, I think, for the lecturer to give an evaluation for the student task, kind of that have to be followed for every lecturer. Okay, thank you very much. It's a very, it's a very great answer. I think the same things that happen to every dental educational institutions in our country. I actually really curious with if I may ask a question to Dr. Lisa from Indonesian University. I mean, you've done a research to get a feedback from the students about how the method of distance learning effectively used in your department. So I actually wondering with the lecturers, because as we know that the distance learning using technology actually more familiar for the students, because young generation is more familiar with the advance of the technology nowadays, but it could be different with the older generation. I mean, is there's any difficulty or not at all?
Yes. Yes, thank you very much, Dr. Yossi, for the questions. It's very true because of the generation gap. I think the students are more familiar with using the technology than some of the lecturer, and there is a resistance, not resistance, I would say there is a difficulties for some of the lecturer to get used to the distance learning approach in the beginning. But I would say right now, because the distance learning is almost implemented for almost 1 year, now majority of the lecturer has get used to of the system quite well. But the one thing that I need to point out that the students' preference toward distance learning, it's not only depends on the students because of the character of the self-regulatory behavior, but also coming out from the lecturer itself, because the ability of the lecturer to engage in this innovation technology are not similar between lecturer and lecturer. And that's, I think, what happens in the beginning when we conducted the study. But as I said, that around this time, that there are more lecturers, even the senior lecturer, that are more familiar with the distance learning. Mungkin bisa ditambahkan, like in the beginning, that when we applied the Microsoft Teams, for instance, because of the complexity of the technology, many lecturers are still used to use that. Then they might be familiar with the WhatsApp chatting. Then in the beginning, that we did not limit the platform that being used, so they can use whatever platforms that they're comfortable and familiar with. But at the later time, that they start to learn how to use this Google Meets and Teams, and I think I can say that almost all of the lecturer now is already familiarized with the system, because the Microsoft Teams, one of the advantages is also we can upload all the assignments, PowerPoint, not only for the online meeting platform, but also any other features that can be used in the system. Mungkin itu
Thank you
dokter.
very much. Thank you very much, Dr. Lisa. Okay, I think it's I think it's the same with in Hasanuddin University. We have a platform called Sekolah. Sekolah is a online platform actually that can be used for all lecturers and also students in Hasanuddin University, and we can evaluate and monitor the things that happen during the educational program or system that happen or the process that happen even before the pandemic, but now it's become more effective after the pandemic.
Yes. I think there are many things that we think we cannot do it, but the pandemic
makes us realize that we can do it.
Ensure that we can actually do it. Yes.
It's like a blessing in disguise at some point, right?
Yes.
Okay, so if there's any other participant who would like to ask questions about maybe who have curiosity about some matters related to the dental education process that have been delivered by several presenters, please. I actually still have lots of questions in my mind, but if there's any other want to ask a question, please.
Maybe can I ask question for Dr. Ninu?
Please, Dr. Lisa.
If while still waiting for other participants to ask question, probably.
Yes, please.
Thank you, Dr. Ninu, for giving the very elaborate sharing the strategies that been tackled by the Faculty of Dentistry, Airlangga University. My question is related to the. If I'm not mistaken, that you mentioned that in the new normal era, that you will have 50% of face-to-face and 50% of courses that conducted online. Can you elaborate more on this face-to-face learning? Because in our university, we still limited the face-to-face session only for the skills lab courses that is very difficult to be delivered online. So what about the experience in Airlangga University?
Thank you very much, Dr. Lisa.
Yeah.
Dr. Ninu, please.
For the thank you so much for the question.
Sorry to interrupt.
For the beginning of the
Wait, is there any inform, Sintaro-san?
Yes. Dr. Ninok network is
Yeah.
poor, so maybe she should mute her camera just to save bandwidth.
Okay. Let me turn off.
okay.
Okay, you may continue,
Okay.
Dr. Nino.
Is it better now?
Yes, much better.
Okay. At the beginning of the pandemic situation, we still have some offline session because at that time we start in the middle of the semester, right?
Yes.
Yes, it is.
Around March or February, March.
March 2020.
It's counted like that because previously we still have like offline condition, and then after the pandemic session, at the beginning I think we especially for the course only some of them conducted the offline session. However, it's very limited and with very strict health protocols. I have this number from our team, but I think in the reality we have a very strict protocols. For example, I knew like the clinics are open just to finish the students that are very need time to finish for graduated, something like that. But after that, we close, and in many cases, it's very strict limitation for that one. That's why in the future we only limited 5% offline activities.
Thank you very much, Dr. Ninu. Dr. Lisa,
Maybe
is there
that's
any?
what can I answer, Dr. Lisa?
Yeah. Thank you, Dr. Nino.
Thank you very much, Dr. Nino. Thank you very much, Dr. Lisa. Do we still have time for the discussion session?
Around 5 minutes.
5 minutes.
5 minutes. Okay, I actually still have a question. So, to Dr. Nino and Dr. Lisa, if I may, I really appreciate and I'm very grateful to to see and to have your presentation. It actually enlightened my mind. But still, there's a very big obstacles, I think, in whether we want to have a student with a very good quality. If we want to maintain the quality of our students, I mean, how can we ensure that, I mean, for the preclinical levels, where in the normal way before the pandemic, they're supposed to treat the patients. I mean, they're supposed to implement it, the knowledge that they already learned in undergraduate level, and then they have to like practicing it to the real patients, and they have to learn how to treat patient in a more holistic way. But now, because there's a pandemic situation, because everything is like very limited, we cannot like treat patients in a direct way, and we cannot teach them how to treat patient in a direct way. How do you think that we could still maintain the quality of our students as they graduate as a dentist? But I mean, we have to ensure that they still have a qualification, a very good qualification, a very good quality as a dentist, even though they have a limitations in treating the real patients during their education time. Thank you very much. Dr. Lisa and Dr. Nino, please.
Yes. Okay. Thank you, Dr. Yossi, for the questions. I entirely agree with you. I think this pandemic situation has the real consequences in the education. So, particularly for the dental training, because not different from the medical study, medical education, that not all of the training can be delivered online, because the students need to have these psychomotoric skills and treating the patients in real time. But I think because of we need to think about the safety and health first above all, then the second options that we can deliver to students in order to continue the education and maintain the student academic progress is to shift it. I think it's also been applied in Hasanuddin University. It's also moving all many of the requirement that's usually done in patients, and they do it in phantoms, so they can still learn the procedural knowledge and skills. However, maybe the psychomotoric skills could be enhanced later in the once they graduated, because they have to go through this magang setelah lulus, karena
internship.
Yeah, the internship because of this compromise. I think they can still get the education, but parts of the education where they doing it in patients, then they have to move it in the using the phantom. Maybe that's for me. And for Dr. Nino, mungkin ada tambahan.
Okay, thank you. Actually, I didn't get the question because I left.
I'm so sorry.
Just come back. Okay.
It's about
the skill. Yeah, you can continue. Do you want to explain the question, or I try to catch it?
Actually, please repeat the question.
Yeah, thank you. I mean, how can we ensure the quality of the students, our students, during this pandemic session? I mean, before the pandemic, in a preclinical situation, they could treat the patient directly. I mean, the real patient, because they have to implementing the knowledge that they have learned during the undergraduate program into the preclinical program. and then after that they will graduate as a dentist. But now in pandemic situation, there's a limitation and they cannot treat the real patient. I mean, how can we ensure that they still have the same quality or same qualifications with the other graduations dentists, the other graduated dentists that we already produced before the pandemic?
Okay, thank you. I think for this one, I have previously in 2012, I have an opportunity to go to the St. Redwood University in Netherlands to learn about how they do the clinical experience and everything. At that time, it's not the pandemic yet, but they already conducted everything like what we did right now. The reason is because they have less patient and also for ethical reason. So they also do practical in mannequin. They provide students with very clear models, and then they can do practice. And they usually at that time, because there is restriction about the pandemic, they open the university, and each student can come if they want to practice for their skill. Outside or within the supervision of the supervisor. But basically what they conducted at that time, they also learning the skill from the practice, not from the patient. They practice it in the mannequin, something like that. So I think it's very possible for us to manage in this situation, and also because we have the program like the internship after the education finish, something like that.
Thank you very much, Dr. Inu. So actually, it's a very possible, and this is also like a very good opportunity, like to do adapt, like Dr. Melissa said at the very beginning of our session. Thank you very much. I would like to remind to all participants, don't forget to fill in the questionnaire and also the attendance list. The link already put on our chat feature. And thank you very much. I would like to return the lead to Dr. Melissa, please.
Thank you, Dr. Yosi.
Could I add something?
Yes, Dr. Inu, please.
Yeah, I think for us, the one that we miss is like we practice using the models, but the hardness of the model, the mannequin, the hardness of the teeth in the model is not quite similar with the like a real tooth. So the sense of the
tactility, our tactile.
When to
whenever we do like
it's different. So how much we should put the pressure so it's not come to the pulp, something like that. I remember there they also practice using the what do you call it, augmented realism or something like that. They put a camera, so they can practice like what I think is like games right now. When you want to become practice like become a pilot, you can do the maneuver of the that one. So you get the feel, and you also get the sense that you can see, something like that. And it could be implemented in the dental education as well. However, it's maybe I don't know about the cost, but it's possible, something like that.
Thank you very much, Dr. Nino.
Yes.
Dr. Melissa, please.
Yes. So we have reached our end of discussion for today's topic. And thank you very much for all of our speakers for giving a very interesting presentation, also for having a very fruitful discussion. So basically, as a conclusion, all of the faculties have presented here, and we have all innovated our dental education system. And for the lectures and PBL session, I think everyone already have a very good modification, and the students also can already adapt. But for the clinical skills lab, research laboratory, and also the clinical practice at the professional level, we still have to think more about how we can give very good clinical practice to our students using a very difficult situations. So I think it's this APAN 51 dental session is a very good way to share our experiences, and perhaps we can learn from each other and keep innovating, having a very good discussions, and we can have more exchange later on. So thank you very much for joining us. And for our APAN sessions, dental sessions, every year we have this type of session with different topics. So please feel free to join us in different discussion, or if you want to propose a topic, you can contact also Dr. Aksa Shuhada here from University of Erlangga. Then we can have a very good session in different topic as well. So thank you very much for your participation. We will see you in other session. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you very much,
Thank
everyone.
you.
Thank you,
Very
everybody.
great
Thank
conference.
you. Wonderful presentation.
Thank you
Very
for
great
sharing
presentations.
experiences.
Welcome to the community. And Dr. Yosi,
Thank you.
maybe you can help me to arrange the next topic for clinical topics, for clinical issue,
Yeah, I think that's a very good point, because we still have lots of obstacles. I mean, something that we have to solve out. I mean, because I think in some centers it's still a problem, the same as in universities as well, I think.
Yeah. Okay. Bisa
Do we have
live ya?
timeline? Do we have timeline? I mean, for our next
Around August.
meeting?
Around August.
August.
Yeah.
August. Okay.
So each year twice, about twice, Dr.
Yeah.
Aksa?
Twice.
So
So we only meet like twice a
But
year.
basically, I am happy right now because we have super team that Dr. Lisa and Dr. Yosi. We have super chairmen. Yeah, you are the future of the APAN meetings. Yeah.
Thank
Indonesia.
you. So we only like meet for twice a year.
Twice a year.
If you want to add more, we can make it.
So I mean, it's a very good thing, because of the pandemic, we could like strengthen the connections between the people in a very distant way, in a very better way. So this is like a very
circle,
yeah. So this is one of the good point of the e-learning things.
Actually, we already tried to make this APAN popular quite some time now, but after the pandemic, then it became
you could like rise up star.
Okay, so thank you everyone.
Thank you everyone. Very nice to meet you. Hope to meet you
for
soon
the
in a very good.
Thank you very much.
Stay safe and healthy.
Stay safe. 3M.